Hi, my name is Debbie Komisak. I'll be doing this video presentation on teamwork and critical thinking. Using conflict in a positive way to promote teamwork can be done by recognizing that conflict is normal in an interdisciplinary group, and first recognizing that it's normal, it needs to be also recognized that it is not necessarily a bad thing. When groups work together, efficiency and outcomes can be enhanced. However, differences and disagreements will occur. These conflicts open up discussions for the team members and input a variety of opinions that helps resolve the conflict. 3 roles from Benjamin and Newman would be, that I chose, would be the definer, the synthesizer, and the emotional monitor. In my nursing practice, when I worked as a clinical manager for a pediatric home care company, we had a baby coming home for the first time from the hospital to his home, and they were going to be provided with nursing care. So I was in on a team meeting with quite a few interdisciplinary team members to make the transition from hospital to home a smooth one. We had a team meeting at the hospital before discharge to get the interdisciplinary team's suggestions and goals for this patient to go home. The nurse practitioner, I feel she would be the definer of the team. She led the meeting. She had all the pertinent and relevant information of this patient, clinical and his clinical reality. He was a trach and on a ventilator, had a feeding tube and a colostomy. He was just an infant. He was going to go home to the parents that needed a lot of support. She was confident and straightforward and very knowledgeable of his clinical information, the support that was needed, and the outcomes we were hoping for. Among the team was a social worker who I feel was the synthesizer. She collaborated the resources that were necessary for all that was needed in the home for this patient for a smooth transition, such as the DME supplies, early intervention being set up in the home, and was available to answer any questions and be a go-to person for the parents. I feel I was the emotional monitor in this team meeting. I had the emotional and personal challenges that the parents would have, and brought out these aspects to the team members, such as how the parents would deal with nurses being in their home, how it would affect the normalcy of their lives and the privacy on a day-to-day basis, and just the overwhelming daily challenges of having a special needs baby in all it entails to care for him. The team meetings for taking a medically complex child home from the hospital were very valuable. Everyone in the team also included OTPT, speech therapy, pharmacy, played a decisive and important role to collaborate all the many factors of getting this patient home. I believe all members of the team had respect for each other, that it worked, the work they did to make this patient able to get home, and no one team member could have done on their own because of the planning that was needed. They would not have been able to do it themselves. That's